Welcome everyone. This presentation will go over important aspects related to sudden death in epilepsy as they pertain to a thorough death investigation in these cases. At the end of this presentation, the participants will have gained familiarity with the definition of sudden death in epilepsy, also known as SUDEP, and the importance of diagnosing SUDEP at autopsy. They will feel comfortable with diagnosing SUDEP as a cause of death and will be able to debunk some of the most common misconceptions related to the presentation of SUDEP cases. Epilepsy is defined as at least two unprovoked seizures that are more than 24 hours apart. These are seizures that occur in the absence of factors such as fever, alcohol withdrawal, or concussions, and essentially are unprovoked. SUDEP is defined as sudden, unexpected, witnessed, or unwitnessed, non-traumatic and non-drowning death occurring under benign circumstances, with or without a witnessed seizure in an individual with epilepsy, in which a thorough postmortem examination does not reveal a cause of death. An important exception to this rule is that deaths occurring as a result of status epilepticus do not qualify as SUDEP. It is important to recognize that every 1 out of 200 Canadians suffers from epilepsy. Of these patients diagnosed with epilepsy, SUDEP deaths account for upwards of 2 per 1,000 people. This number increases to 9 per 1,000 people in the cases of treatment-resistant disease. The diagnosis of SUDEP is most common in young adult age groups. Amongst people with epilepsy, those with refractory epilepsy are the highest at risk for SUDEP. In addition, patients with younger age at onset, the risk of SUDEP increases up to 8%. Furthermore, risk of sudden death is also increased in people who suffer from more frequent seizures. Though SUDEP is not the most common cause of neurological disease-related death, it is the second most common disease to cost a significant loss of years of productive life. SUDEP is an entity that is important to study due to the multifactorial nature of proposed underlying mechanisms. It is proposed that the initiating event is a seizure. This seizure could be of any phenotype. The seizure episode leads to the following physiological changes: decrease in arousal, neurogenic pulmonary edema, and autonomic instability, which includes abnormalities in heart rate, blood pressure, and respiratory rate. All of these changes lead to one common endpoint: central apnea. In addition to the presence of these physiological changes, an additional insult in the form of a vulnerable state, a susceptible host, or underlying neuropathology leads to a failure of autoresuscitation and re-regulation of the central apnea, and this failure of reset to normal leads to SUDEP. The most likely explanation for this difference is that an underlying genetic susceptibility hinders the autonomic reset mechanisms in these individuals. This is in contrast to patients who do not share these predispositions and survive seizure episodes. The main goal of SUDEP research is geared towards reducing deaths by providing strategies for risk stratification of at-risk individuals and identification of modifiable risk factors. This can be accomplished by focusing the research on identifying the genetic risk factors, as this information will carry implications for surviving relatives. In order to accomplish these research goals, the first step is identifying suitable cases. This is also the most challenging step for various reasons. One of the major barriers to appropriate case identification is lack of awareness of this diagnosis. and the discomfort surrounding issuing a straightforward cause of death statement that includes SUDEP. Let's take a look at these definitions for SUDEP as a cause of death. Although these definitions are geared more towards research classification, they provide a good framework to at least trigger a forensic pathologist to start considering SUDEP as a cause of death. In addition, these definitions also provide a framework on what may or may not constitute an alternative cause of death. Let's start with a recap of definitive SUDEP. Definitive SUDEP is sudden, unexpected, witnessed or unwitnessed death in a person with epilepsy under benign circumstances without a history of trauma or drowning, in which the complete autopsy does not reveal a cause of death. SUDEP plus is diagnosed once all the conditions of SUDEP are met, but there may be another condition that increases the risk of respiratory depression. Probable SUDEP is a category where the case by its history would indicate SUDEP, but an element of the post-mortem examination is lacking, such as toxicology or neuropathology. Similarly, possible SUDEP is diagnosed whereby the case would meet criteria for SUDEP, but post-mortem examination reveals a competing cause of death, such as an old myocardial scar. Traditionally, a seizure-related death comes with a history of tongue bite, urinary incontinence, and a witnessed grand mal seizure. Although useful, one must bear in mind that these elements of history are not necessary for the diagnosis of SUDEP. Some of the most common misconceptions or misunderstandings, such as the patient must be found in bed, the death must occur after a sleep period in a prone position, the decedent must have a tongue bite, or evidence of bowel and bladder incontinence, and that one cannot diagnose SUDEP if an epileptogenic focus or cause of epilepsy is found at autopsy. One needs to remember that these findings or lack thereof does not exclude SUDEP as a cause of death. SUDEP should be considered in the differential or cause of death for any case in a patient with a history of epilepsy who has died under benign circumstances. To summarize, sudden death in epilepsy, or SUDEP, is an important diagnosis to consider in any cases with a history of epilepsy. Identification of these cases will help in providing answers about underlying genetic susceptibilities and hopefully lead to prevention and risk stratification models that can be translated into clinical practice for caring in patients with epilepsy. This named position paper provides a good overview of the topic. Lastly, thank you for taking this short course on sudden death in epilepsy and partaking in our research survey. Please do not forget to complete the post-presentation part of this study. We appreciate your time and input.